Alright guys, so we got through some of the anatomy of the thigh and hip, and now we want to do some anatomy of the pelvis. Okay, so here's a picture of our bony landmarks for our pelvis. Um, and I want to start right here in the middle. Okay, this is the sacrum. So if you think about your low back, this is where your low back comes and attaches um, down into your pelvis. Okay, so your lumbar spine would be right above here, and then this is your sacrum, and down here is your tailbone or your coccyx. Okay, so the sacrum is important because it articulates with this big bone, the ilium. Okay, and the ilium it's part of your hip, but it's part of your pelvis too. Okay, so this joint that it creates right here is called the sacroiliac joint. Sacrum, ilium, sacroiliac joint. Okay, and that's going to be important when we talk about some of the spots where the muscles attach. Okay, so then this is the ilium right here. And the main thing I want you to know on the ilium is that this is the iliac crest coming across the top. And if you felt your own side, your iliac crest is that hip bone that's rounded on top. So if you feel your side, you can feel your hip bone right there, and that's the iliac crest. And if you follow it all the way to the back, there's a bony protuberance. So if you feel your own and follow it all the way back to right above your butt, there's a bony spot that sticks out, and that's your PSIS, or your posterior superior iliac spine. You can't really see that on this one because we're looking from the front. But if you follow that iliac crest all the way to the front, you have another one, another bony protuberance. And if you feel that on yourself, follow it all the way to the front of your hip bone, and that bony spot that sticks out, that's your ASIS, or your anterior superior iliac spine. So you have a PSIS and an ASIS, and then the iliac crest. Okay. I'll note also that there's an AIIS, anterior inferior iliac spine. So there's another little spot there, as well as on the back there's a posterior inferior iliac spine. But those parts aren't as prominent. You can't really palpate them as well. So we don't necessarily need to memorize those for the quiz for this class. But we do want to know the ASIS and the PSIS, okay? And then the iliac crest. Then we have also part of the pelvis is the ischium, and that's this part. And on the next slide, I'll show you, it shows you really easy. It's color coded where it divides, but that's the ischium. Okay, and then the pubis is down here at the bottom and makes up the other half of this little, you can see there's like a ring right here. So this is the pubis, and the pubis includes the pubic symphysis, which is this right here. So right in the middle of your pelvis, it's not actually connected by bone, it's just connective tissue. And that allows a little bit of freedom as both of your hips are walking. When you're walking, they're moving separately, and so this pubic symphysis allows a little bit of motion. Otherwise, if it was all connected, these two hip bones wouldn't be able to move separately, which would be very uncomfortable. Okay, so it allows a little more freedom of movement there. Okay, so there's your basic pelvic anatomy. Obviously, there's a lot more we could go into, but that's all I really want you to know. On this next slide, you can see how it's divided. Okay, so this is the ilium, is all of this. The green portion is the ischium, and the pink portion is the pubis. Okay, so that helps you kind of separate out where those bones are. Okay, and then right in the middle, right here, is called the acetabulum. Okay, and when we looked at our femur, let me pull that slide up. Here's the femur, here's the femoral head, and the femoral head is going to sit right into that acetabulum, right into here. So that's where the femoral head's going to go into. So this is the anatomy is very similar to the shoulder. It's a ball and socket joint, but this acetabulum is much deeper. And I think I said in the other video, but it's more like a softball sitting inside of a bowl, meaning there's a lot more bony stability to it. Whereas the shoulder, what the glenoid cavity was more like a plate. So the humeral head sitting on the glenoid cavity was like a softball on a plate. And the femoral head on the acetabulum is more like a softball on a bowl. So there's much more stability there. Okay, and then last thing to note on the ischium, we have the ischial tuberosity right here. And that's where all those hamstring muscles are going to attach. Okay, so one, that means that the hamstrings are crossing that hip joint from the femur to the ischium, making them a hip extender. And they also cross the knee joint, making them a knee flexor. So they cross two joints. But that's where they're going to attach, right there on the bottom of the pelvis. Okay. One more slide. Kind of shows you. So here's the sacrum again. There's the ilium and the iliac crest. Here's that posterior superior iliac spine that's really prominent. Okay, and that's really what makes up that sacroiliac joint, where this PSIS and that sacrum articulate. People get a lot of low back pain right in there, right where those articulate. A lot of times that bone presses up against the sacrum and causes pain. And really what it is it's all the musculature that sits around this, right? This isn't showing all those glute max and the hamstring muscles and the back muscles. But when those muscles are on there, they can cause a lot of pressure and push those bones together. And so when we treat that PSIS pain, a lot of times we're just trying to loosen up those muscles so that they don't create so much pressure. Okay. Next slide. I don't usually have you guys learn the nerves in the body, but I thought this was an important one to point out because if you've ever heard of sciatica, sciatica is that radiating pain that shoots down the back of your leg. And sometimes it goes like through your low back into your butt and then down the back of your leg. And here we can see the sciatic nerve comes out of that sacroiliac joint that we were just talking about. Okay, so right here, the sciatic nerve is going to come out from in there. Go back, see, we can see it right in that sacroiliac joint. And so a couple of things that can happen that cause sciatica. One, the bones, the way that they developed could put pressure on the nerve. And usually that's either genetic or something that occurs when you're growing up. So some people get sciatica because of that bony pressure on the nerve. And we can't really treat that in the clinic because the bone is just set that way. They can do surgery on it if it's really bad, but it's not optimal. But a lot of times what happens is all those muscles that we've seen in previous slides sit over the top of it, and specifically looking back at this PSIS joint, the piriformis muscle right here, if it's really tight, will cause compression. See, the PSIS is going to, the piriformis is going to come out right here, and it can cause pressure and put pressure on that sciatic nerve. And when it puts pressure on it, it causes everything below it to be inflamed. And if you've ever had a nerve pain or a sciatica, sometimes it's tingling and numb. Sometimes it's like a burning sensation. And it can be very painful and sometimes debilitating. So those are two reasons why the sciatic nerve might be inflamed, causing sciatica. Okay. Just some functional anatomy to know that the pelvis moves in all three planes. So if you think about these ilium, I just call them the big ears of the pelvis, but they move, they rotate, they move front to back, they move side to side. Okay, so they have a lot of range of motion within them, and that's, that pubic symphysis kind of allows that PSIS joint kind of allows that. But that's really good to know when we're trying to rehab pelvic injuries, is that they need to have range of motion in all different directions. And so working with, hip abduction and adduction and rotation of the low back and pelvis can all be very important. Okay. Another thing to know is just the forces that the hip has to go through is tremendous. Right, you think about running, jumping, all kinds of athletic movements that all come through the hips. So they're very, very important. And so they can be easily injured, and usually, think about these bones. These are very thick and big bones. They're not usually fractured. So usually what we're dealing with is muscular injury, muscles putting pressure on the joints, muscles getting strained, stuff like that. Okay. So we'll start some of the rehab techniques here, and then I'll finish it up in the next video. But of course, just like any other injury, we want to think about general body conditioning. Now that we're getting into lower extremity injuries, it can be more difficult to keep their general body conditioning. If they have a pelvic injury, you might not be able to get them on a bike. You might not be able to have them run. You might not, be able to do a lot of things. So this is where being creative is really helpful as an athletic trainer. Can you get them in a pool with this pelvic injury? Maybe, being in a pool, and that kind of takes away that weight bearing stuff that can help them to be able to still do some sort of cardiovascular conditioning. Or, do you have a hand cycle where they, instead of spinning with their feet, it's like a bike for the hands, to allow them to still get some conditioning? Are there core exercises that they could be doing? Could they still be doing their upper body lifting, stuff like that, so that they're still getting some exercise and staying in some sort of shape? Okay, and then as we start, we want to think about, pain-free range of motion. And that can be both from the torso twisting movements that occur through the torso and pelvis. So we want to think about twisting. We want to think about the leg, the thigh itself, going through abduction, adduction, flexion, extension. And then one other thing is pelvic anterior, an anterior pelvic tilt and a posterior pelvic tilt. And when we look at this pelvis, okay, if the anterior part of the pelvis were to rotate up and the posterior part down, that would be a posterior pelvic tilt. And then if the anterior part comes down and the posterior part comes up, that creates an anterior pelvic tilt. Okay, so that's another range of motion to think about in your hips. You can have that anterior or posterior pelvic tilt. Okay, so we want to think about those kinds of things. So I'll get into some of the stretches and mobilization in the next video. If you have any questions, please post them to the discussion board. And I hope you guys are keeping up with these.